My name is Dr. Vikas Murchia. I'm board certified in female pelvic medicine and reconstructive surgery. I was one of the first surgeons to attain this subspecialty 2 years ago when the board was established. Some of the common problems I treat as a urogynecologist include pelvic organ prolapse. This is prolapse of pelvic organs, bladder, uterus, rectum, through the vagina, coming out to varying degrees. So pelvic organ prolapse, urinary incontinence, variety of urinary incontinence, stress or urge incontinence, or a combination of these. So the most likely causes of urinary incontinence are similar to those which cause pelvic organ prolapse. I would say probably the greatest thing is pregnancies. Then following pregnancies is how many times you've been pregnant, how many kids you have, the number of pregnancies, the route of delivery, how big the babies are. All of these things really factor in. Along with that then comes advancing age. As you get older, typically these problems tend to occur. But be mindful that this is not only a problem of old age. You can have young women who've had just one child and they can develop prolapse and they can develop quite significant severe incontinence issues too. So pelvic organ prolapse is exactly what it says. It's the prolapse of pelvic organs through the vagina, okay? So what are your pelvic organs? You have the bladder, you have uterus, you have the rectum. So you have these three organs, and all of these organs are supported by your pelvic floor. And if you have a defect in your pelvic floor, much like you have a hernia, okay, these organs can prolapse through and they can protrude out varying degrees. At Good Samaritan Medical Center, we're sort of pioneering on how we're able to do sacrocolpopexies, which are the gold standard surgery for pelvic organ prolapse. This is placement of a graft material between the vagina or cervical stump and the sacral promontory to help hold up and support the vagina so that you're not having this prolapse. We're doing this with the single site procedure. So a single incision, less than an inch wide in the belly button. And literally after 3 to 4 weeks from the surgery, if you look at their abdomen, you can't see any surgical scars. So one of the types of incontinence is stress incontinence. Stress urinary incontinence is the hypermobility, primarily hypermobility of the urethra, which leads to urinary incontinence. This is, whether it's a younger person or an older person, when they're being active, running, coughing, sneezing, lifting things, when they're just trying to engage and live life to its fullest, they're having inadvertent accidents and leakage of urine. And it's caused by hypermobility of the urethra. Their urethra moves too much because when they do anything, their intra-abdominal pressure increases. It causes a drop in their bladder and urethra. With that mobility of their bladder and urethra, they have small leakage of urine. So how do you fix this? Well, you try simple conservative measures first. If those work, fantastic. You don't have to do anything more. But if they're not sufficient and the patient continues to still experience incontinence, then the simplest things that we have for them is a procedure called a suburethral sling. Suburethral slings it's a placement of a sling that goes underneath the urethra to support the urethra so that when they do cough, strain, lift, do any kind of exertional activity, it stabilizes the urethra and prevents and treats their incontinence. Stewart Good Samaritan Medical Center, I think, is a fantastic place to work and a fantastic place for me to bring my patients to provide them services. I think they're a leader and an innovator in providing services to the South Shore area. They're the first to bring the Da Vinci system down here, to make it available for their surgeons to use, to offer more minimally invasive ways to treat a variety of problems that the patients have.